I want to point out that Nadiya Iqbal could not present today, and instead of her, we'll hear from Professor Boyd Goodson, who will speak about hyperpolarized gas imaging of lung ventilation in a clinical point-of-care portable MRI scanner. Boyd, the screen is yours.
Great. Thanks, Danila. Thanks, everyone. Yes, this is a talk that was to be given by my PhD student, Nadiya Iqbal. But indeed, there is a new resonance with Perm today and she is happy for me to share that she just went into labor a couple of hours ago, a little early, but we're all happy to hear that. So I'm going to walk you through her slides instead. So yeah, this talk is at least long-term focused on trying to find a new way to do clinical functional pulmonary MRI. The good news is that hyperpolarized xenon, which is hyperpolarized by spin exchange optical pumping, was recently approved for clinical use in December 2022. And this was really hailed by our hyperpolarization community because it was the first FDA-approved MRI contrast agent, hopefully the first of many. As far as I know, it's actually in 2 US hospitals so far. And what I mean by that is you could literally go into those hospitals and your doctor could decide you need a xenon scan. It could be prescribed for you, and then hopefully it can even get billed to your insurance and paid for. Other indications are on the way. So for example, not just imaging the gas space in the lungs for ventilation imaging, you can also look at the condensed phases of xenon dissolved in different tissues and look and see how those are changing over time and use that as a way to actually look at response to treatment. Here in this case, I think it's in IPF. There are still translational challenges. I mean, I love hyperpolarized xenon. I've been working on it since I was a graduate student in the Pines lab in the 90s. And in fact, the first human imaging with hyperpolarized xenon happened in the 90s. But only now is it starting to appear in hospitals, and we hope that it really takes off, but it's not quite there yet. And that's, I think, because there's just still a number of translational challenges. First, the xenon polarizers are expensive and they're complex to operate. They're still kind of a really sort of a longish time to polarize, tens of minutes to start getting enough xenon to use. But I'm really going to be talking here about that the current implementation requires high field MRI, which is not exactly a high throughput methodology. And the bigger issue is that virtually all clinical MRI scanners are proton only. So talking about high field in general, we heard a little bit about some of the advantages of trying to do low field imaging by Thomas Spola earlier. Well, MRI scanners are expensive to own, site, and operate. They're bulky, they're immobile. Scans can be time consuming, they're confining for many patients. With respect to trying to do lung imaging, there's susceptibility issues at high field, and also most scans patients lying down, and that's not ideal for doing functional lung imaging. If you think about trying to do low field MRI, that can potentially allow point of care imaging where you take the magnet to the patient instead of vice versa. And low field can also obviate a number of the above limitations, but then you're also fighting detection sensitivity, and the contrast limitations are also present challenges. So if you turn it around and say, well, okay, if you have a sensitivity boost and novel contrast that are provided by hyperpolarized agents, they can be highly synergistic with low field MRI, particularly if the hyperpolarization technique is itself low cost, rapid, and portable. And so a lot of this thinking goes way back and from hanging out with these guys you see over here at Checkmanov and Matt Rosen. So speaking of Matt Rosen, here is a clinically available low field point of care scanner from Hyperfine. And I think Matt's pretty much the brains behind this device. This is an older version of the scanner you see here. You also saw one in Zahid's image earlier. It's deployable in hospitals, and it's already been demonstrated in a variety of indications, including TBI and hemorrhage. So again, you got to see some of Nadiya's work briefly in Zahid's talk. This was a sort of a bigger demonstration. We're integrating it with Sabre. And in this earlier work, she was able to show you could use the scanner to quantitate, to not just image, in this case, pyrazine, but also quantify the enhancement and use it to calculate limits of detection, et cetera. And this was published in Analytical Chemistry. And to show that, yes, actually, particularly since the Sabre conditions were so non-ideal, the enhancements actually weren't that big. And you can back out numbers that suggest that, oh, we're easily already in the realm that if you had, say, the magnetization density that you would get with propane or pyruvate, you're already there to start doing hyperpolarization imaging inside this point of care clinical scanner. So the setup that we're looking at here stemmed actually from a single visit from Ed, who came down from Wayne State. He brought with him some kit, including some excised rabbit lungs, and we wanted to see, hey, if we could actually do void space imaging or ventilation imaging in these lungs, as his group has led at higher field, and you saw some of those images in Igor's talk, which was awesome that I had that to lead in. And the setup basically involves a pretty simple setup involving a rhodium on titanium dioxide catalyst. Propylene is going to go in, get hydrogenated very quickly. We're talking on the seconds time scale. And then it's going to be directed into a sample that's inside the scanner and out to vent. And then the internal pressure is going to be governed by a little valve here that you may or may not have onto it. All right. And I'll show you the results first and then explain how we got them later. That's how Nadiya had designed this talk. You'll see a number of 3D printed objects that are kind of holding these phantoms, for example. So a water phantom at the lower left, and then either another phantom, say, where the gas is going to come in the upper center. Here's a successful image of imaging hyperpolarized propane gas. And then this was later demonstrated in the excised lungs. This was not an easy experiment to do. And I'll talk a little bit about why that was. And we had to do it inside a sort of a plastic iron lung, if you will, where the lung is inside an external pressure vessel so that we can actually pressurize it and make and get the image that way. But you do see by doing this, we can actually get more signal from the lungs than we actually got from a water ball and have some fun with it too. She made a 3D printed phantom. You can kind of see the SIU there, and that's with hyperpolarized propane gas as well. All right, that's the phantom. All right, so what's so hard about imaging this? Why did I think this was not going to work? And I warned the students, Nadiya and Ashani particularly, I don't really think this is going to work. I don't know why Ed is so optimistic. But luckily, Ed's informed optimism was much greater than my naive pessimism, and I'm the happiest person for it. But why did I think that it wouldn't work? Well, first, you have the general challenges you would expect with trying to image diffuse gas. You've got very short hyperpolarization lifetimes with propane, 1 to 3 seconds. And they depend on the pressure in the field, but it's very short. So we need super fast scanning. The signals are antiphase. So you need to at least be able to partially separate the resonances or they're going to cancel out. So that brings me to the specific challenges with this scanner. We're at a low frequency, so we're going to have less sensitivity intrinsically. There's only a 2 hertz chemical shift difference. So here's a spectrum that was taken by one of Ed's trainees, and you can clearly delineate on a benchtop the difference between the methylene and methyl resonances of hyperpolarized propane. But at our field, they're only going to be about 2 hertz separated, and that's kind of scary. So there's going to be a huge tendency for the lines to cancel out. And I was also worried about the fact that, well, we're going to have poor filling factor. We have a head coil that we're going to use to be detecting some small volume. The B naught inhomogeneity, this is a permanent magnet. I actually expected this to kill any hope. The scanner, of course, is not designed to do anything remotely like this. It has pre-programmed everything, pre-programmed delays, some of which you can change and some of which you cannot. And so a lot of the things are what they are, and we're having to work around that, and a lot of effort was put into that. So one of the images showed at first is actually a successful demonstration of getting hyperpolarized propane, but it's a D6. I'm going to talk about why that is in a second. At elevated pressure compared to water. So that worked, but the first indication of the challenge that we have, you can see in the spectra. So our hyperfine scanner is allowed for research. So one of the things you get when you have the research license with it is you can do spectra. And here's a typical water spectrum from one of the water balls. You see a nice strong spectrum here. These are magnitude spectra, by the way, and that's hopefully understandably important if we're talking about getting antiphase signals. If you try doing normal propane, even at an elevated pressure, right, you get a tiny little signal, okay? Even when you do D6, which Ed thought would be a significant improvement and later was vindicated, you barely see anything, maybe nothing here. I mean, which of these spikes is real? Maybe this one. But then when you actually elevate the pressure just a little bit, it's night and day and you get a huge signal. And so if you compare this signal to the water spectrum, we're off by about 8,000-fold. If you compare the signal from the images, we're off by about 46,000-fold of what I'm sorry, we're off by about 40-fold is the way I should say it. 8,000-fold enhancement for proton compared to the expected 46,000-fold enhancement in spectra is what I meant to say. And with the images, it's a much larger difference. It's almost like a factor of 40. That's how much we believe we're losing, even in our best case scenario. So I look at it positively. That means that it's kind of a Christmas miracle or a Halloween miracle that it worked, but we have a lot of room for improvement. Okay, so part of the changes in the sequence that she made, well, the first one was to make it a non-3D sequence. Out of the box, this thing takes two to 5 minutes to run, depending on your conditions. We remove the third dimension so that we're basically doing projection and just do it in 2D. So that allowed her to lower the scan time to just about 2 seconds. All right, and the other thing was to reduce the bandwidth significantly, and I'll talk about that some more, and then also change the excitation pulse. Obviously, you don't want a 90 for something like this, but surprisingly, 30 was better than 45. I'm not sure if that's a calibration issue or what, but that was also enabling. So if you try to do this with propane, non-deuterated, meaning not normal propylene, we never got any image signal, no matter what we did. And that was part of the reason why I was pessimistic, because this wasn't the first time we tried to image a hyperpolarized propane in the scanner. But Ed brought down deuterated propylene and pre-mixed it and with our pair hydrogen to first do benchtop to make sure it's working, and then trying to do the MRI. And then if you see here with her first attempt, you see a little bit of signal where that ball is. And so what I thought was, okay, let's try reducing the spectral width so that we can get more points per hertz, if you will, and try to spectrally resolve those antiphase peaks. And sure enough, as you increase or you should decrease that spectral width, it actually starts to come in quite brightly and quite nicely until the point where the acquisition time is too long and you're probably fighting T1. Okay, so again, comparing the case of trying to do propane and propane D6, it's night and day. It's night and day when you compare at ambient pressure versus using at the slightly elevated pressure of about 30 psi. Here, the resolution. All right, so to calculate signal to noise, she basically just did kind of the standard approach that you would do when you have magnitude only image data to calculate signal to noise. So it's 105.8 averaged over this region of interest and significantly greater than that of the corresponding water ball. All right, so to actually try to get an image inside the lungs, we couldn't do it under ambient pressure. That was clear. So we were desperate. I saw a soda bottle that we could use, and Ed very tactfully and carefully was able to excise the heart from the lungs, keep the lungs intact, and ship in a bottle style was able to insert this thing inside the soda bottle so that we could actually use it to pressurize the outer part with helium and then have the inner part inflated at this elevated pressure. And to my sheer amazement, it actually worked, and we got a strong signal here from the lungs. And this corresponds to sort of, if a bit blurry, first-in-kind image of doing ventilation lung imaging and a low-field point-of-care scanner. All right. Obviously, we're leaving a lot of signal on the table. I mentioned probably a factor of 40 at least. But there's a number of things we can do. We only spent just a few hours trying to optimize the sequence and the conditions. We could have used better parahydrogen. We are interested in maybe also trying butane or ether because those may have beneficial benefits, or trying to use trick the scanner into doing pulse sequence variants that would allow transfer from the singlet more directly into magnetization. There could be razor advantages here. That's another thing to think about. But in any case, our long-term goal is to help stimulate the development of point-of-care MRI-based methodologies for both pediatric and adult lung imaging, perhaps to enable upright imaging for ICUs, clinics, et cetera. All right, so tons of people to thank and not enough time to thank them, so I'll just point out a few people. I mentioned Igor and Ed also for their kind of approaches for the advantages of using deuterated substrates for doing hyperpolarized gas imaging. And the advantages, I should add, are not because of T1. It's really because you simplify the spin system so that you kind of better approximate a normal A-B spin system, and it's easier for the coherents to find their way and not get lost in other pathways, I think. And that's part of the reason also why you want that longer detection time or narrower bandwidth in the imaging. Who else here? Let's see. Thomas, for sure. We've had lots of exciting discussions about low field imaging and things you can do with SLIC. Matt, the brains behind the scanner, and our continued collaborations there. Certainly Ed Shekmanev, whose vision and bringing down everything that we use would not have been possible to do these experiments without him. But also the students who were involved, particularly Ishani, and then most importantly, Nadiya, whose fantastic work I've been able to show off here today. And we hope you'll join me in wishing her and her family the best as she's looking to transition in this new exciting life with her new baby. So thank you.
Thank you, Boyd. I guess we have time for one short question, and we have one in the Q&A. How do you prevent anti-phase signal cancellation and preserve singlet order at 64 millitesla given the 2 Hertz chemical shift separation?
Yeah, well, my first answer is you can't, because I thought it wouldn't work. So I'm a little bit in agreement. I think it is just a matter of with the deuterated case, you have at least some hope that the spin order can find its way. So then it's just a matter of even a slight bit of non-cancellation. I think that's kind of what you see when you see the 40-fold loss, but not 100% loss. That the 40-fold loss is saying, oh, well, 98% of it is lost to the cancellation probably, right? But the rest of it isn't. So a little bit survives that small area of non-overlap, and that's probably what we're imaging. And it is through the allowing more time for those signals to evolve and to separate that we're able to image anything at all. That's a little bit hand wavy, but that's kind of my understanding right now, and maybe Igor has a better idea.
Just to elaborate, you showed one spectrum of deuterated propane, which was fully absorptive.
Oh, no. Yeah, good point. Yes, as I mentioned, those are magnitude. So this scanner is not super great at doing the phase and representing it. And that's in part because when we get the data, it's already kind of partially processed by the scanner, but we're able to see that when we don't make a magnitude spectrum, there is an anti-phase component. It's just that, and you can phase it so it looks perfectly anti-phase. The problem is that phase isn't necessarily the same exact phase as the water that was taken in a spectrum a few hours earlier. So there's some phase drift, and that seems to be scanner specific. I mean, it's annoying for those of us who have NMR spectrometers whose phases don't drift, but for me, it's also a miracle that they give us that at all and that it can work at all, because it was not designed for that purpose.
All right, thank you, Boyd. Let's give Boyd a round of applause again.